Hi everyone, it's Anthony from STP Buddies. Welcome to another episode of STP Buddies Talk, where we're going to be talking about training in a pandemic, being on the STP and training on a pandemic. So I'm just going to wait for people to come in, give us a wave. I'll just type in today's schedule, what we're going to be talking about. Any questions you have today, please put them into the question tab. I have a couple of questions here already that we're going to go through. And we're also going to have two guests today. One guest from audiology and one guest from genomics. And I'm from cardiac. So come in. I'll give it about 1 or 2 minutes or so, and then we're going to get cracking. I can see a couple of our guests in there already, which is good. So my name's Anthony. I'm here for part of STP Buddies. I created STP Buddies mainly just to shine a light on current STP students. A lot of people don't actually know students on the program. So I thought, okay, why not actually create something where people can see real faces that are going through challenges, going through experiencing different specialisms, and we can kind of share what we're learning and, kind of share our progress and tips with people that want to come into the program as well. So that's what we're going to be doing today. So my first guest, I'll invite Meg on first. I hope that she's alive at the moment, and then we'll take it from there. Any questions, like I said, if you're just joining, make sure that you leave a question in the question tab. I have a couple questions here already, and then we'll take it from there. So we're just waiting for Meg to come into the live. I'm seeing all the waves, so thank you guys. Should be a good one. Should be a good about maybe an hour or so that we're going to give towards this. And then we'll get started as soon as possible. Oh, good. Okay, I'll go for. So I'm going to invite Milena instead. Then we're going to invite Meg afterwards. So we're going to start off with audiology. Hi there. How are you?
Hi, I'm good. I thought Meg was going first.
Yeah, but we'll go first with you.
Okay.
How's everything? How's your week been so far?
Good. Today was actually really busy. So I'm a bit stressed with work and so on, but it's been good. Yeah.
That's good. The reason I brought you on, I've seen your channel, I've seen what you're doing, very much similar to what I'm doing, really, just kind of sharing my experiences on being on the STP and just trying to kind of inspire other people, but also kind of share our work, what we're doing, so people actually know that there's normal
Yeah.
young people like us working in the NHS. So I have a few questions, one
Yeah.
specifically for your specialism and ones that I can answer as well. But before we do that, for people who don't know you, that don't know, okay, your journey on the STP, try to paint the picture for us about, okay, your journey. How did you even find out to the STP, to getting on, and how you're doing right now? So the floor is yours.
Okay, thank you. So my name is Melina. I'm an STP in audiology. I To be honest, I don't exactly remember how I first found out about the STP, but there was a girl from my university that was also applying, um, and that's how I think I found out about it. And I had no clinical experience before I studied neuroscience. Um, And I like science, but I wasn't sure that I wanted to stay in the kind of academia route and do a PhD and so on. I wanted something a bit more, I guess, practical, interactive. And I had done some research in hearing loss, but at like molecular level. So I was interested in hearing and thought I would apply for the STP. And yeah, it was quite a long application process. Quite nerve-wracking, but yeah, I got a place in the end. So I'm now based in Winchester in Hampshire.
Okay.
And I just started this September. I'm in my first year, and yeah, that's
Okay.
it.
Were you in service or direct?
Direct entry.
Okay.
Yeah,
So,
so
so I've
I had never worked in a hospital before. That was completely new to me.
Okay. That's a bit different to me. Well, thank you for sharing, first of all. So I'm in first year as well. I'm in cardiac science. For me, I previously worked in a hospital before as a cardiographer, which is essentially an ECG technician. So I was working there in London after I finished my placement as a trainee cardiographer, ECG technician. Um, and where I finally found a permanent position was where I applied on to the SCP. This was my second time applying, however, as previously I applied and didn't get in because those
Okay.
aptitude tests are really hard.
Yeah, yeah.
Yeah, they're very hard. So I took the in-service route, and for people who don't know about that or may have a rough idea, I'll try to explain it quite clearly. Basically, when you have an in-service position that you apply for, compared to the direct entry, you're not competing against anybody else for that position. You're going up against yourself for that role. It's kind of like going towards or going for a job interview, but you're the only person applying. It doesn't mean that you'll directly get it. I still had to complete the same application as direct applicants. I still had to pass those aptitude tests, which they've now scrapped, and we'll touch upon that later. But that was the main difference. So I already knew, compared to direct applicants who didn't know, I already knew where I was going to work. I was already working at my workplace. It's just that my role had changed to now being on the STP and starting the program. So we've had a couple of questions specifically for audiology. I don't have that much knowledge about it at all, to be honest. So this
Yeah.
will be a learning opportunity for me as well. So one of the questions that we have, and something that I would like to know as well, is what is your typical day look like? We'll touch on the university side later. We can both touch on that. But in terms of, okay, now you're in your first year in audiology, what does your work look like? You put on your scrubs? Do you not put on scrubs? Yeah, take us there, please.
Yeah, of course. By the way, today is World Hearing Day, so just to raise awareness about hearing and
Cool.
hearing loss. And yeah, so I mean, I think it depends on the department you are at, but we don't wear scrubs. We have like a polo t-shirt and then just wear formal black trousers and shoes. Um, and in first year, we mostly focus in kind of routine adult appointments. Um, and in second and third year, it's more the pediatric appointments, vestibular appointments, which is balance related things, and the kind of more complex diagnostic ones. Um, so my typical day, I probably go into work, just check my emails and so on, as I'm guessing everybody does. And then we calibrate the equipment, so all the headphones, the tympanometer, which is basically something that measures the how well your eardrum moves, just all our equipment to make sure it's working well. And we have appointments the whole day. We have different kinds of appointments. We see patients. It's a very patient-facing role. So we see patients that are referred by their GP or by ENT, that have some kind of hearing loss, and they're struggling. So we do hearing assessments and tests. We fit hearing aids and kind of provide hearing rehabilitation and sometimes some sort of counseling, especially for people that have tinnitus. which can be quite, it can have quite a big impact on people sometimes. You know, they can't sleep. Yeah, we also have, as I said, lots of different kinds of appointments, and then just easier appointments such as repairs and things like that. Now with COVID, we see fewer patients than usual, so we also have postal repairs. So a lot of patients just send us their hearing aids and things like that, and we look at them, and also do a lot of appointments by phone now.
Wow,
Yeah.
interesting. I didn't know that that much in terms of it seems to be quite varied in terms of the actual test that you're doing and the kind of pathologies behind why people are coming in. Is that correct? Would you say that's the
Yeah,
correct?
so we have quite a lot of different appointments. So I guess because I think audiology is, from what, you know, talking to some other people within the STP, it's quite different in terms of we see the patient, we do the tests, and then we give them the results and discuss a management plan. Well, I think a lot of other specialisms do more of the testing part of it, but then the
Yeah,
results go back to
diagnostics.
the doctor. Yeah.
Yeah.
So we kind of have the full pathway with the
Mm,
patient, and then see them every 3 years for reassessments and
yeah. I guess that
things
would be
like.
quite rewarding on that side, seeing that you can actually take the patient through the whole pathway from start to end. Would you
Yeah,
say that that's kind of a rewarding part of the
it
role?
is definitely. I think it can sometimes be hard. You know, we've had patients cry in appointments. Not very often, thankfully, but you know, it is quite a distressing thing. Sometimes people are not happy when they realize that they do have a problem that needs, you know, they need a hearing aid.
Mm,
Because I think there's quite a lot of stigma around it, that, you know, it's something that old people wear, and, you know, to a large extent it is, because age-related hearing loss is, I guess, the majority of the patients we see. But it's not only that, and, you know, we have the pediatric clinic, so we have kids and babies that come for testing. There's a wide range, but it is quite nice to be able to explain the results to the patient and kind of do a bit more of the, I guess, the counseling part of it, and, you know, explain how things are and what we can do about it, and discuss with them and figure out what how they'd like to proceed. And yeah.
no. When I think back to when you were just explaining the pathway, I was thinking, that kind of differs to being in cardiac physiology, where predominantly the main diagnostic tests are, if we speak non-invasive anyway, we have electrocardiograms, which are just
Mhm.
ECGs, 12 leads. Sometimes we fit portable versions of these called Holter monitors, and we have cardiac ultrasound, um, echocardiograms, they're called. Those tests, people come in for those. And with all of those tests, it's purely diagnostic, where you're patient facing, you perform the test, but then the patient goes away. With the halters, we do receive them, and then this is what I'm kind of undergoing now. Part of my training is to actually analyze those different, what we call tapes. So it may be 24 hours of a patient's heart rhythm and rate. And, we're looking at the shape, we're looking at the morphologies. People come in with symptoms of palpitations. Some people may have atrial fibrillation or kind of dangerous arrhythmias, such as episodes of VF, which can be kind of a precursor for sudden cardiac death if they don't get if they get left on their own. So on that side, it's purely focused on the tests. Um,
Mhm.
it's only when you go to the cath labs where you're actually performing and you're doing invasive work, where you're doing angiograms, where you're getting to see the actual structure of the coronary arteries, and people get fitted pacemakers, and they could have maybe because one of their leaflets in their heart's not working, their valve, sorry, they may get like a aortic valve replacement. That's where you kind of see the other side of, okay, this is invasive treatment.
Mm.
But at the same time, I would say it's quite diverse because there's so much you can do in terms of the tests in cardiac. And I would love to hear from you in the last 2 years where you normally specialize in your STP, I could either become a physiologist specializing in pacemakers or a physiologist specializing in cardiac ultrasound, which is kind of more visual, and there's a manual element where you're not just performing the test, but it's dependent on the operator's accuracy and actually getting good windows of the heart. So that's like an added challenge. It's quite interesting. Have you thought about, and this is the main reason why we're here today. Okay, we're in the middle of the pandemic. You're going through audiology. Has audiology or how things have gone, has it changed because of the pandemic in terms of the work-based training?
Well, because I didn't have any clinical experience before, I can't really, I guess, directly compare how it was. I basically just started in the pandemic. But I am aware that there have been quite a few changes. We've reduced the number of patients we see every day, and as I said, do a lot of things over the phone, or people send us hearing aids, we fix them and send them back. And I think there have been some changes in kind of the structure of how we do things. And over the summer, in the first lockdown, I think we weren't doing fittings of hearing aids in person, so we would kind of set them up and in clinic and then send them to the patient. But I mean, as an STP, I think it's affected us quite a lot, not just within my main department, audiology, but for example, I haven't managed to do any of my rotations yet. I don't know if you have.
Yeah, I'm going to touch on that, but I was going to hear from you first.
Yeah, everything's just being a bit delayed. I think one of them was going to be arranged for February, but that didn't happen because I think once the latest lockdown started, they kind of didn't want to have anybody. But I'm hoping that now with the vaccinations, it will kind of be easier to get a placement. Yeah.
For me, with rotations, it's been a challenge, but again, for those who don't know, in cardiac, your rotations for the first year will be vascular and respiratory and sleep. Respiratory and sleep is one specialism, is one rotation within itself, sorry. So I was fortunate enough to start my vascular rotation as soon as I came back from the 6 weeks at university, which was done at home because we didn't go up to university. But so from October, I would say actually from, I think end of October to around December, I completed vascular. So for 3 days, I would be there. My main objective was to actually undergo training so I could actually pass my practical assessment, which was performing a ABPI, and I had about 10 or 12 so competencies that I had to complete as well. Didn't have to complete by then, but I was advised by other SCP students to kind of do it as you go along rather than leaving it to last minute. So thankfully I was able to do that. But again, we went into another lockdown, and I was supposed to start respiratory and sleep science after Christmas for the new year. But because again, the whole department has been redeployed, there's nobody there. So that has had to be postponed. But the main theme for me, definitely, that this has taught me, this has been my first experience of being on the SCP, of course, is just I've had to learn to be adaptable. I can see Meg. Yep, thank you. She just sorted out that issue, so we'll invite Meg afterwards. I've just had to be as adaptable as possible. For me, I like to kind of plan my days. So what I do, I stick to like a schedule where I've spoken to my training officer, and she would have told me, like vascular, that okay, look, you're doing vascular from October to December. After Christmas, this is the plan. So that gives me a lot of ease, even when things don't really go my way, especially with the rotations. Beyond that, in terms of like university assignments, because again, we're at university, we're part-time students, having a schedule of kind of what I'm going to do day to day, planning and selecting annual leave around that, and around my study days just gives me as much time as I can to get my work done away from the workplace. So just a few days ago, in fact, I submitted 2 case studies, my first case study since my undergrad. And you know as well as I do, that takes a lot of time getting into the rhythm of academic writing, but at the same time, we're multitasking. We're also doing our clinical work. How has that looked like for you? Are you a type of person that, you know, like me, likes to kind of plan a lot, or what type of tips or techniques have helped you kind of balance the work side and the academic side of the program?
I definitely do a lot of lists and try and plan a lot. It doesn't mean that it always works out. I think
Yeah.
I probably make
Yeah.
a lot of plans that I don't actually stick to. But it does help. I have a little note just above my desk here with all the competencies for Introduction to Audiology, which I still haven't finished, and just which ones I've uploaded and which ones have been signed off. I think being organized is something that you really, really definitely need at the STP. I think it's really hard to go through it if you're not organized, because there's so many things to balance, and it is quite complicated. Whenever I talk about it to my friends or my family and I say I have a lot of work, they're like, oh, for the university, and I'm like, no, for work. And they're like,
Is the toughest thing to explain to
what?
anybody.
Yeah. Like, explaining what competencies and OCEs and
Yeah,
DOPs are is just
yeah.
quite, yeah. But yeah, actually I'm quite new to the STP Instagram thing, so I haven't uploaded quite a lot, but I like seeing what everybody else does, and I
Yeah.
guess it's kind of motivating and inspiring seeing how everybody schedules their day and what they do and so on. So yeah, I think also it took me some time to get into that kind of mindset of, okay, I need to do things constantly and not leave them, because it does add up quite a lot. And I think I've gotten to the point now where, you know, I'm doing my competencies as soon as I can and so on. But yeah, you need to be quite organized and disciplined, I
Yeah,
guess.
quite on
Yeah.
top of everything. We've got a question from Rebecca here.
Yeah.
She's curious as to how much contact we have or with other specialisms or year groups. Do you want to answer that first, and I'll give that answer?
Yeah. So you'll have contact with other specialisms in your first year when you do your rotations. So for audiology specifically, we do audiology, obviously, and then neurophysiology, ophthalmology, and we do a mix of pathology and radiology. So you will have contact with other departments that usually will have 1 or 2 STP students as well. And you'll also meet people at university. So we haven't actually done that because we haven't been able to go to university. It's all been online. But it, you know, you'll still get, I guess, to meet these people online, and you'll have to do group projects with them and
WhatsApp
things
groups.
like that. So you definitely yeah. And you know, at my university we also have staff student meetings that are open to all the STP years, so you get to see and talk to the people from the other years a little bit. So you do have some contact. And there's, you know, it might also be that there's another STP student in your department that started the year before you, something like that.
Yeah. I think for me, the main place that I've seen other students outside of my department was on rotation.
Mm.
So when I was in my vascular rotation, I was with I believe, a second year student, and he was one of the actual members of staff that was actually helping us when we were doing our APPI training or doing carotid scans, which was very interesting and cool to do. So for me, I think if not in your department, and if you're on your own in terms of, okay, direct entry into your department or in service, you will see people. This may be a kind of a trust welcome day. So if there's multiple specialisms in your trust, you will see people around. If not that, then in the different rotations that you do, you'll probably see people as well. So it's not a thing where you'll be alone or you won't kind of be able to interact. Of course, it's difficult in this pandemic as to why, we're creating these sort of things for people that are on the program. To me, seeing like the people that I've had on before this and the people that I'm kind of interacting with now is always good to see what other people are doing. And that's a new way that I'm adapting myself to actually still know people and stay connected when I haven't met them because we haven't been able to go to university. So yeah, hope that answers the question.
When we do go to university, it's only a few weeks, but the majority of the time you're in your trust and we're all scattered around the UK. So it is nice to have those times at university where you get to see everybody else that does the same thing as you. Yeah.
So we've got another question. Maybe we'll answer a couple more. How much travel is involved? Do you want to answer that?
Yeah, so I think, again, well, first of all, you'll have travel for your university, unless you're lucky enough to be in the same city as your university will be. But I'm now in Winchester and my university is in Birmingham. So normally I'd have to go there and stay there for as long as each university block is. So our first one was 3 weeks, and then we had 1 week in January. So usually people just basically move there for a few weeks, get an Airbnb or something like that. So there is travel involved, and within my trust we have kind of the main hospital that I work in, but also 3-4 other hospitals that we sometimes travel between. So people might go to one of them once a week or something like that. So because I'm still, I guess, in the beginning of my training and I can't really do anything unsupervised, I'm not allowed to, I suppose. I haven't actually been to any of those other places. I'm still mostly in our main hospital. But I will have to travel, and I think that's probably the case with other trusts as well. I'm not sure if you have that.
Yeah, so for me, similar to you, my trust, there's many hospitals. There's 2 main ones that I travel to and fro. Another question on travel was about, like you said, the university. Seeing if my university was open, I would have traveled for 6 weeks to Manchester Metropolitan and stay there. Similar to you, people do maybe Airbnb and stuff like that. For us, there was a kind of a set amount of money that you could then get back once you pay for accommodation. So in terms of kind of finance, that would have been a help. And since we haven't been able to use it there, we have been able to kind of maybe buy like a cardiac book or something like that instead. Yeah, so for me, there is travel, and that's one thing that I actually like because I'm a person that even clinically, I like working in teams, but I also like working independently. So the fact that no day really is the same, or no week is really the same in terms of my schedule. I can be in one hospital learning tape analysis, then I can be in another hospital, maybe helping my department performing ECGs if the clinic gets busy. Less nowadays, obviously, because there's less patients. But yeah, with the majority of trusts, there's normally more than one. So expect to sometimes be having to move, especially for rotations. Having to move, and it's just another good thing. I think makes it more interesting.
I know my neurophysiology rotation is definitely in Southampton, and I think that rotation is about 4 weeks, so I would just go there for about a month. But yeah, every STP student, just directing this to whoever asked the question, I'm assuming you might also be worried about costs but every STP student gets, I think it's around 2,000.
Yeah, £2,000. Yeah, 2,000.
Which, I mean, we don't get to manage it directly. It goes to our training officer, obviously.
Don't give it.
But yes, it's used for travel and accommodation, or other things that we might need for the STP. So you
Yeah.
will be covered. Don't worry about
Yeah.
it. You don't have to pay for all
There
of
is
this.
help. There is help.
Yeah.
Um, let's see if we can find another one. You already talked about the dress code, but
Yeah.
just in general, from your experience so far, in terms of um, your expectations, okay, you know, you spoke about how the process, especially as a direct applicant, is very long and drawn out. Has being on the STP lived up to the expectations you once had? If not, how has your experience been overall?
Yeah, so I guess I wasn't sure exactly what to expect, because I didn't really have any experience other than being at university. But it is, I do really enjoy it now. I guess I'm not really sure what I was imagining it would be like. I wasn't really sure, but I do quite like it. I think sometimes it can get quite stressful, and you do get told that quite a lot when you're applying, and they say it's very competitive and you have a lot of things to do and you have full-time work and assignments and you have other things like the competencies, and all these kinds of things that you need to do. um, but I guess until you actually start doing it, you don't realize how much there actually is. But it definitely, yeah, I'd say it's lived up to my expectations. I'm really enjoying it. I'm really glad I chose to do this. And yeah, what about
We've
you?
got, oh, for me, I think when I realized the first 6 weeks, so yeah, the first 6 weeks I was working from home and then attending lectures through Microsoft Teams and things like that. And the amount of work that I was inundated with gave me, yeah, I had a greater respect for STP students on the
Yeah,
program that I once saw in the department, you know, rushing to and fro. They were either going past me or going. I was like, why are these people so busy? But actually being on the program, seeing the level, you know, this is a postgraduate degree, is a
mm,
master's. So definitely it's a step up from my undergraduate degree in terms of the workload, what they require for you, and that's pushed me to actually be more disciplined in terms of my time management, and just, you know, putting my head down and working, getting things done. Um, because, like you would probably agree, there's always something to do.
yeah,
And normally there's two or three, or or
yeah,
sometimes four or five
yeah, yeah, definitely. It's not
things to
just one
do.
thing.
Yeah, there's
Yeah.
not just one thing to do. So that's definitely pushed me in terms of being comfortable to regularly be multitasking, and, you know, also within that, setting time to rest and keeping certain times of the weekend to relax and spend time with friends, catch up with friends and family and things like that. So yeah, it's challenging on that side because there's always something to do, and it's on you. You know, you have that independence really to get started with competency straight away, or not so straight away, or when you go into work and you have, I don't know, a free afternoon. What are you going to use to take up your time? Are you going to get some practical working in a certain test that you're going to need in the future? Um, or are you going to start preparing for an exam that you have in a couple of months and things like that? So yeah, there's kind of enough scope for you to kind of decide what you want to do. And I guess over time, it's just been a thing of, okay, I plan and then just focus on executing that plan. Sometimes my plans don't go how I would want them to be. That's fine. It's just about kind of adapting and seeing, okay, what can I do now? This happened, for example, I can't do respiratory seat rotation. What else can I do? And trying to speak to my training officer and my mentor that I've been assigned, and kind of talk to other students that I know that, you know, around my hospital, in my department in higher years, speaking to them, saying, okay, look, this is what I'm doing now. What would you do in this situation? Or could you help me out? And everybody's kind of very friendly. Again, you have the online kind of platforms like this, and the other students that we see, it's like there's always somebody that you can reach out to. You just have to try to reach out and yeah, don't
Yeah.
do things on your own.
Yeah, I think it's really important to talk to other students and students in the year above, because I think the STP, even though you are doing a master's, all the work competencies you have, I think the National School of Healthcare Science is quite flexible and maybe a bit vague in terms of what you can use as competencies, because I've talked to lots of people, and I know different departments kind of accept different things for competency evidence.
Yeah.
So I think if you're just starting, you can feel quite lost because there aren't any specific instructions on what things you need to do.
Yeah.
So it can feel a bit uncertain. So it's always good to reach out to older years and other STP students and see how other people are doing this. Yeah.
Okay. So we're gonna get Meg in, but before you go,
Yeah.
guys, Melina has a Instagram page where she's going to be posting more, as she said,
I'll try
about
to.
audiology, her experiences. So please go and follow her after this. This will be on YouTube as well as Instagram. So yeah, make sure you follow her. Apart from that, thank you very much for
Yeah,
joining
thank
us.
you.
Again, I know you're probably very busy, extremely busy, as we all are, but it's always good, I think, to kind of share about our experiences and let other people kind of gain information from the experiences that we've been through. Any last words at all?
Yeah, no, this was really good, and thank you. I'd say if anyone's watching that would like to apply for the STP but they're not sure about it, just give it a try, do it, because I know a lot of different people apply to the STP that have more or less experience, and don't get intimidated by it, and you can try 2-3 times as many as you like. And if you have any other questions that we haven't asked, you're welcome to message me on my Instagram. And yeah, thank you.
Okay, cheers. Thank you very much. And yeah, enjoy the rest of your evening.
You too. Yeah.
So now we're just gonna go straight ahead. We're gonna get Meg on from genomics. Um, yeah, if you guys are liking it, give me some hearts just so I know that I'm focusing on the right stuff for you guys. This is just kind of like more of an informal chat compared to the other SCB talks where we're kind of talking about application, just so you can get more information about people in the program, the day to day, and we can just kind of answer questions back to back. So yeah, now we have Meg. Thank you for the likes. I'm seeing them. Yeah. Thank you, thank you, thank you. Hi
Hello.
there. How are
Sorry
you?
about that earlier. I'm good. How
Yeah,
are
no
you?
problem. I'm well, thank you. I'm well, thank you. Welcome to STP Buddies Talks.
You.
Today, we're talking about training in a pandemic. Um, yeah, so we just had Melina from audiology speaking about her experiences. I've kind of touched in between about my experiences being cardiac first year. So yeah, we just want to continue that for another 30 minutes or so. Yeah, so if you can, please introduce yourself. Who are you? What has your STP journey been from applying to now? And yeah, paint the picture for us.
Of course. It's been a very big change. Like if you'd have asked me a year ago what I'd have thought I'd have been doing now, it would not have been this. But I've really loved it. So I'm Meg, by the way. And I'm on the genomics stream. So I'm based in Birmingham. Based at the Women's Hospital here because that's where our genomics lab is, but it's part of the Women's and Children's Trust. So I came from uni. I came from my master's. I did a bachelor's in medical genetics and then my master's in human and molecular genetics, and then came following that onto this. So I had dipped my toes into the water of how much work we were going to be having like would have to do. But it still kind of hit me in the face a little bit when we had to go to uni.
Yeah.
But yeah, it's been a strange one just because it's been quite virtual, and we haven't been able to be in the lab like we would have been in other years, even though we aren't particularly lab based. We'd have still gone in and had a look around and kind of seen the technologies face to face. But it's still been really useful and really good, and we are able to go into work if we want to work in a more like office-based environment, because I often find that it's difficult to work at home, I think, for me personally.
Okay, so your hospital has kind of made adjustments for you to kind of, okay, we're not kind of doing the regular thing, we're not in a regular place, like you said, the labs, but they have been flexible. How has that been? Has that been what you've wanted?
Yeah, 100%. They've been so supportive. It's a strange time, but I think the fact that we came in September and they'd already had, so pandemic obviously started in March, they'd had a bit of time to see what kind of works, what maybe doesn't work so well. So by the time that we started in September, everyone was just so supportive, and they've like reassured us throughout that we can come in should we want to. We can work at home if we want to or we need to. And so I'm on the bioinformatics rotation at the moment, and my training officer for that has been lovely and really supportive, and said that we can go in if we're finding anything a bit tricky and want to go through it with someone like in person. So I think it's just about asking for what you need, and just trying to let them know how they can support you as well.
Yeah.
But yeah, I've been really lucky with my department. They're lovely.
Yeah. I can definitely attest to that. I think when you're on the STP, like I was speaking to Melanie just now, the more the support you have, the better. And I think it speaks to actually trying to build professional relationships with the people around you, from your training officer that you're given to permanent staff that aren't on the STP but they're in the department, and informing them about what you're actually doing, what you're up to. And these are the same people who, in my experience, when I've kind of maybe needed assistance and maybe finding a case, or I needed time to maybe move away from the department and work on an assignment, they were more willing to actually try to help and make way for me, because I'm bringing them along in the journey, and rather than just now already being in the department but doing something else and them not really kind of knowing what I'm doing and things like that. So communication, especially to other people in the department, I think is quite important. So I'm coming from cardiac. I don't know too much about genomics. Sometimes
I don't know a lot about cardiac.
yeah, so this can be a learning opportunity for both of us. You know, I remember for my undergrad, I'd done a dissertation when I was looking at different ECG abnormalities between ethnicities, and I've made a short comment on, okay, there may be genetic variants in between ethnicities and things like that, but all I've ever done is kind of dabble in terms of, you know, my literature in terms of genetics anyway. So for someone like me who may not know about, you know, genomics and things like that, for people listening, because there's been so many people that have messaged the STP Buddies platform saying, we need genomics, we need to
I'm glad.
find somebody. Please kind of inform us with, okay, what do you do on the role, what it's all about, and the impact you're having in your department.
100%. So I might be a bit biased here, but I think genomics is one of the most interesting things in healthcare science and normal science at the moment, because it's just clearly so linked to everything, but we don't know loads about it. So there's so many like research and learning opportunities coming out from things being published every day. I absolutely love it. But as healthcare scientists, our genomics lab is kind of split into, I guess, three groups. So we have cancer, so they'd be they're then split into familial cancer, which is like inherited things. So I guess an example would be a BRCA variant. That's quite a common one. So if your mum has a BRCA variant and you've inherited that, we might be doing some testing to see whether you've got that. And then there's also somatic cancer and like non-inherited cancer. So that would just be someone coming in with maybe like a breast cancer that's not due to a familial variant in the BRCA gene. Sorry, I think that's a bit confusing. But genetic testing for that can really help with modifying treatment plans and things like that. So with a blood cancer, you can have a blood cancer that's quite responsive to treatment, and that's obviously really good. I think it's got like a 90% response rate. But if it has another genetic variant in a different gene, that can really dramatically affect how well the patient's going to respond to treatment. So it's really important to kind of be checking these different sites in the genome to see what the best route for the patient is and give them like an accurate picture of what's going on so they can make the right decisions for them. So yeah, there's the cancer side, and then there's the rare disease side. So again, this is kind of split within this to prenatal and postnatal. So prenatal tests might be coming in because a woman's pregnant and she's had a scan and there's been some abnormalities that have been identified. So this, I guess the most common thing that people would think of is Down syndrome. So we'd be able to see if there's an extra copy of chromosome 21 and provide a diagnosis for that so that she can make the right decision for her. And then there's also postnatal things within rare disease. So if someone's been infertile or they have infertility issues and they can't work out why, there might be a genetic reason underlying that. So we could have a test for that as well. And then there's like specific genes, so like the Huntington's gene, we might screen for that if there's a known history in the family or the patient's presenting with those kind of problems. And then there's also, which I think is really interesting, developmental disorders. So things like learning difficulties and behavioural difficulties and epilepsy and autism and things like that. There's starting to be a lot more understanding that there is actually a genetic factor at play, and it's not just a kid is naughty or something like that. And I think this is such an interesting part of genetics at the moment, because it's something that we don't know loads about, but it's expanding a lot. And yeah, and then I guess within all of those, there is the research side of it. So people might be like familiar with the 100,000 Genomes Project. So that was screening cancer patients and rare disease patients that don't currently have like a diagnosis to try to find something that will help them with their treatment. And yeah, I think Matt Hancock said something a few years ago about wanting to sequence every baby that was born, which I don't particularly agree with, but we shall see. It's definitely becoming like a linchpin in a lot of diagnostic cases at the moment, so it is a really interesting field to be getting into. Sorry, that was very long-winded.
No, it's good. It's something that I've learned, because even getting people on and interacting, looking at the specialism list, there's not just one specialism for genomics. There's actually a breakdown. So thank you for explaining that. I've got a question from Jessica here, wanting to know about what sort of exams we've both been given. For me, so I'm at Manchester Metropolitan. I'm doing cardiac at the uni part-time anyway, as with everybody on the program. For me, so far in December, I had a multiple choice exam, and that was based on the 6 weeks of work that we've done at university. And after that, I've since done a reflective piece of coursework and 2 case studies, which I just submitted last week or this Monday. I don't know. It's been a long day. Yeah. So I've done that side. It has been kind of the academic assessments and exams, and I'll have one exam in May as well. So for you, how was your timetable looks like? I know you had an exam recently. Yeah, yeah.
did.
So kind of give us a
Yeah,
breakdown, please.
still getting over it. No, it was fine. How did you find? Oh, I'll ask you afterwards once I've gone through mine, to be fair. So we had the same thing as you. I think we had the block of uni in
Yeah.
October, November time. So within that, we did genomics, which is understandable, bioinformatics, genetic counselling, and then reproductive science, and then a week of introduction to healthcare science, which is what I had the exam on the other day. So these all reflect the rotations that we do. I think some people do different rotations, but those are the 4 ones that we do in Birmingham.
Mhm.
So during the uni teaching block, we had a group work assignment in bioinformatics, which was like we had to make a presentation and create an SOP and submit it at the end of the week, which I was kind of dreading, but I actually found it so useful because afterwards you then had to do an individual piece, which was like a similar type of thing. We had to analyse a variant. So having that group work foundation beforehand was so useful for when I came to do the individual piece. I think I'd have found it so difficult without that. And then in January, we had a short answer question exam for genetics. So that was a strange one because it was 5 days long and open book. So it felt a bit strange because it didn't
Wow.
really feel like an exam. So
Yeah.
I found it hard to kind of prepare for it. But it went well. And then on Monday, we had the Introduction to Healthcare Science exam, which was multiple choice.
Mm.
And then we've got, what have we got left? A professional practice written assignment, and for the start of May, I think. And then,
Summertime.
yeah, at some point. And then a reproductive science exam and a genomic counselling exam as well. So we got those to look forward to.
Wow, let's look
How
forward
did
to.
you find your assignments?
The assignments, again, because the last time that I've been in academic mode was my undergrad. So I finished my undergrad in 2019. I done my undergrad in sport and exercise science, and with a placement year. The placement year was when I actually worked as the ECG technician, to which I then found out about the STP, and tailored my dissertation around it. So once I finished in 2019, I then worked for a year. So coming back to, uni mode, for the STP, it's been a while to say the least. But knowing that and understanding how I've worked, I've just had to approach my assignments a bit earlier than I would in the past, and it definitely helped in terms of getting ready for the multiple choice exam in December, just gone. My reflective piece and my 2 case studies, which I've all submitted, and I've only got one result back from the MSQ, for the multiple choice exam, and that was good. So I'm expecting good results for the for the other ones as
Well
well.
done.
Yeah, fingers crossed. Thank you. So it's definitely a challenge, but I found that okay, my skills are coming back, and they're actually better, funny enough, despite the gap, because in talking to students that are in maybe second year or third year of the program, speaking to them on how to write, how to get back to critical writing, synthesis, all of these big words which are normally on the higher side of your exam, like marking criteria or coursework criteria rather. Breaking that down, speaking to them, finding out on Moodle, keeping up on updates on Moodle, what's actually going on, or changes to feedback, to assignments or extensions. all of that has really helped me, to be honest.
Mm.
So essentially, I can summarize it by just saying, just keeping my feet on the ground, and just being attentive to new updates in terms of information. And like I said before, just being willing to open myself to people and saying, look, this is what I'm doing. I need some direction, any tips. I'm in countless of WhatsApp groups for STP stuff at work, or STP stuff for my specialism cardiac for my university. So people, from simple things from referencing to other things like, oh, what's the reference style, or how do you submit this or convert this to this? All those little things, it just helps because you're not doing it alone. Yeah, so that's something that I've definitely utilized. Yeah, so how about you in terms of one, in terms of support, but two, okay, genomics, do you see other students? Do you interact with them? How has that looked like for you?
So support wise, do you mean like support from the university, or things that I've done to help like support myself kind of
Yeah, things that
balancing
you've
things?
done that may be maybe unique to you, maybe things that I haven't said.
Okay. Well, I'm one of those people that loves organization. Like, I have online lists, written down lists, weekly plans, like everything that pops into my head has to be written down, because I don't know if you feel the same, but my brain feels like a bath that is full to the brim of water, and if I add something else falls out. So if I've not written it down, it will not be remembered. Pretty much.
I can relate.
So yeah, I think organization is like the biggest advice I can give to anyone. Even if you're not coming onto it a particularly organized person, just trying to find a way that works for you is going to be so important. I think I was quite lucky. Before I started, I was doing a full-time master's, a full-time job, and then a part-time job for like 4 months, which was just, I'm not going to say the worst point of my life, but very stressful. So I think I learned a lot of like tips on how to keep myself less stressed, which is the most important thing for me. And then in terms of seeing other people, so I'm really lucky that I've got another lovely trainee with me on genomics. She's called Christina, and she's so nice, and it's so nice to have someone else we're going through like at exactly the same pace. So just being able to kind of check in, and one of us will have a question that the other one knows the answer to, and vice versa. So that was really nice. And then there's two other trainees on the cancer genomics pathway as well. So there's quite a big group of us in Birmingham, which is lovely. And then the STPs throughout the whole 3 years, I think there's like 15 or 16 of us. So, and they're all lovely. Like, you can go to them with any kind of question and they'll happily help you out. But yeah, and then there's like all the WhatsApp groups and stuff. But I am looking forward to being able to see people in person.
Yeah, same.
Instagram's a lovely place, and I've met a lot of lovely people, but I think just being able to like actually see someone and go for a coffee or whatever will just be joyous.
Before we answer the question from Lorna, on that, in terms of meeting people, similar to me with STP bodies, you've actually created your own initiative as well, which I've seen, and it's been really good. Would you like to speak on that as well?
So I guess it was part of the reason why I started Time for Two, was I wanted to kind of make friends with more trainees and kind of meet more people, because normally you'd all go up to Manchester, and especially with it being in first year, there's a lot of different trainees from a lot of different specialisms all in the same place. So you meet loads of different people, and I just kind of felt like we weren't getting that side of things. But also, when I started, or when I was applying, I didn't feel like there was a lot of information out there on what trainees actually get up to day to day. There were the open days and stuff, which are really useful, But just being able to kind of see what someone goes through in their day-to-day life and what patients they might be encountering, like why has this patient come in and which part of the pathway are you actually involved in, because as a clinical scientist in genomics we won't be doing the lab work. So I think that's something that's really important, because if you're going into it wanting to do lab work, you're not going to get that in genomics, so it might not be the right specialty for you.
Yeah.
So yeah, I started it and it's called Time for Tea. And I've had quite a lot of trainees on. I know there's still quite a few more to go, but I'm hunting them down. So hopefully they'll find it. But yeah, I think someone very kindly put my in the chat, so it's Time for Tea _STP. And then I'm also on YouTube as well, so my link is through my bio, so you can subscribe to that as well if you want to.
Yeah, please do check it out. It's really good.
Thank you.
So
I love that.
Oh, thank you very much. Thank you. And yeah, anytime you need another cardiac, then just give me a shout. I'll be happy to join. So we have a question from Lorna. What is the dress code for clinical scientists in genomics?
So I think, as Melanie was saying, it does vary depending on where you are. I know for us, we aren't particularly smart. We're not meeting patients face to face, so you don't need to get dressed up in like a suit. I know some people wear jeans, but personally I don't feel comfortable doing that yet, so I do wear something professional, because I just feel like I'm gonna feel professional if I look a little bit more professional.
Kind of get into the professional mode.
Yeah, exactly.
Yeah, I understand.
When I'm working from home, I don't, obviously, but if I'm going into the office, I want to look smart and like I've pulled myself together. But yeah, it's different for everyone. I think it's what people are gonna be most comfortable in. If you're gonna get your best work done feeling comfortable in jeans and your department is okay with that, then wear that. It's just that I personally wouldn't want to just yet. And Laura's just commented that it's similar for her department in Newcastle too. She's also a genomics STP. So
I think we've got another person in your specialism, perhaps by her name, asking, what's your favorite part on the STP so far?
That's a good question. I've really enjoyed, so we've not done any like active patient casework yet, but what I've really enjoyed is kind of seeing the sample pathway from sample receipt all the way through to the reporting of the result. I think just seeing all the little intricate things that go on behind the scenes has just been really, really interesting, and there's a lot more to it than I would have initially thought, and a lot more like problem solving, which is something that I really enjoy about the job. But also, surprisingly, have enjoyed my bioinformatics rotation, which I didn't think I was going to enjoy at all. I'm not a very computer savvy person, as the start of this video showed. But the spread of bioinformatics within genetics is unbelievable. Like, they have a finger in every pie. They are involved in every stage of the process, and I really didn't expect them to be as widespread as they are. So it's been really interesting and useful for when I do actually qualify, to know where they fit in and know what they get up to. Yeah, I think it's all been really enjoyable so far. So
for me,
what about you?
I would say it would have to be definitely, I would say, the varied nature of the program, in terms of, working on the rotations, also working in your department clinically, and then having your study leave to just focus on competencies or university assignments that are outstanding. I enjoy kind of my flexibility in work, as to why I mentioned before, working in different hospitals is just, it just makes things better for me, because there's less monotony. And within cardiac, within itself, there's so much diagnostic tests to do, and there's so much to learn. You're always learning something.
Yeah.
And working in different hospitals, there's different staff, different doctors, that if they see me analyzing a tape, or if I'm gonna escalate something that I've seen, there's always people around to kind of give you advice as to how you're going to report something, how you're going to escalate it. So yeah, it's the variety for me, and all those little things makes me excited to go into work, or makes me look forward to what I have coming up next, even though it is challenging, it is difficult, most definitely. But that gives me a lot of joy, knowing that I get to do loads of things at once. The main thing for me is just focusing on actually trying to do all of those things at once, to do those things well, and at the same time learn to take time out, still book annual leave that that I have available, and have that balance between working but also not working, which is very important. And for people on the STP, people not on the STP, mental health is a very, very big thing. And a lot of people's mental health may have suffered as a consequence of the pandemic. And as students, I think it's something that we should bear in mind, most definitely, as well. And I hope to cover that in kind of future lives that we do and things like that. But overall, it's just a variety. No week is the same. And within that, I have control to kind of mold my week or my days to what I need to get done, even though I may be assigned on my rota to do something, or be somewhere, or go through a certain level of training. There's always that scope for me to have autonomy, and yeah, that's what I enjoy the most.
Yeah, I'd really second that on the, you never know what you're gonna get. Like, we could have a patient come through that's pregnant, and then we could have another patient sample come through that's pregnant, and then a patient sample come through that's 50 years old and is starting to experience symptoms. We could have a child with developmental delay. You can have like deceased patient samples come through and things like that. So you never really know what you're going to get, and they can all be for different reasons. And I love that side of it.
So we have a question from Katie. She asks, how many times did you apply before getting on, and any tips about doing so?
So I applied twice. I got on my second time. I think you were the same. Do I remember that right?
Yeah, I was the same. Yeah, second time.
I was like,
A bit of a delay there.
So I applied at the end of my undergrad and then during my master's as well. So I wasn't particularly expecting to get on, so it wasn't a surprise when I didn't get on the first time. But I think it's really important to not be too disheartened. Obviously, you are going to be a bit sad and a bit upset that you didn't get on, but it's not because you weren't good enough. It was just that this time there was someone that just had something extra. But you've now got a whole year to look over your application, start thinking about what experience and what else you could kind of bring to it for the next one. And I think that is something that's so important. Like, don't just leave it until December, January of the next year to apply. Like, you've got an upper hand almost. You know your score from last time. You know whereabouts you kind of fell. So try to just enhance what you already have. I guess that would be my main tip. Even if it's not clinical, like I didn't have experience in a genomics lab. I'd done like 2 placements throughout uni, but they were only a few weeks each. But I think you need to show why you'd be a good fit in the NHS. You need to show that you have compassion, that you can consider like patient confidentiality. In my application and interview, I spoke a lot about my part-time job at uni, which was tutoring children. So obviously you've got like looking after people that are vulnerable, being organised, being able to respond to a wide variety of situations that might get thrown at you. So I think just thinking about what skills you can pull from every bit of experience that you have. Nothing is bad experience. There's no such thing as a bad job. So just try to work out what it is that job gave you.
Very sound advice. Thank you very much. We've got another question here. Is the STP as challenging as you expected? And also, what do you find the hardest about it? So we spoke about a lot of the good things, but how about what are the challenging things for you?
So is it as challenging as I expected? Yes, in some ways. And I guess no in others. I was quite worried about moving to a new city and getting started within a new department. I stayed at the same uni for my master's, and I stayed in the same job for my 4 or 5 years at uni. So the change I was worried about, but that was fine in the end. The whole department is lovely, just as you'd expect. So I think you really acclimatise quite quickly, especially if you're able to go in. You're seeing these people a lot more. What I have found challenging, the uni weeks were really challenging. It felt like they tried to show a whole year's worth of content into 6 weeks.
Yeah.
And just not being at uni as well, having to work in your bedroom. I found that slightly tricky at times, like mental health wise and stuff. Because I think it's quite easy at the moment to carry on working, and work finishes at 5-ish, but you might still be doing things until 8, 9 without even noticing it if you're just working with the TV on. And I think it's something that I found quite challenging, was actually giving myself time off. I felt like I'm getting paid a lot, right? So if I've not got something done, I should be finishing it that night. But actually it's just as important to be able to like wake up refreshed the next day. Bioinformatics I'm finding really challenging, I'm not gonna lie. But I am also finding it really useful, and I'm learning a lot. And you're not going to start the program and be able to do everything. That's not the point of it. It's a training program. Even within the genomics rotation, I learned things that I didn't know about. So I think you have to be receptive to what you're being told and what you're learning, and you're not going to get everything right first time, but you're just going to have to try again. I don't know if you found it the same.
Well, when you were speaking, the word that came to my mind was imposter syndrome. So that's something that I was aware of, because part of my undergraduate degree was psychology, sports psychology, exercise psychology. So that's why I understood the term. But on the program, there's an internal expectation I place on myself to be at a certain place. And again, when we speak about being adaptable and things changing, and or your nature, exactly, mental health, and maybe your capability to work as you normally would isn't happening for a week or 2, that can be a challenge, where you can identify that where you are isn't where you should be, in essence. So I think that's quite a major challenge. But at the same time, it's just understanding or talking to myself, knowing that, okay, cool, I am doing well. I've gone into the habit, like you, I like writing down things each month, all the kind of major things that I do in that month. Let's say for this month, okay, March, I done this event. I'll put that down, and then that kind of shows me that, okay, I am making progress, despite maybe things not going 100% how I planned them to be. And that encourages me to keep going, keep working, and keep moving forward. And then where necessary, speaking to training officers, speaking to other mentors, speaking to other STP students above me that have gone through what I've gone through. And we speak about these things. I may catch somebody at lunch and we're talking, and they'll let me know, oh, this is how I'm feeling because this is what I'm doing right now, and this happened, and I'll be able to communicate with them and tell them my experiences, and then we kind of support each other that way. So I'm more, even though maybe it's not within my personality as a to speak, but I've definitely seen value in doing that more, and it just helps kind of sharing that burden with someone that's going through things as well. And I'm seeing people like Alice and everybody else say, yes, imposter syndrome.
Man, I was actually spoken
yeah,
about
so
that.
I'm not alone. So yeah, that is a major thing, to be honest.
I think what you were saying about writing down what you've done is something that I do as well. So like, I have an online to-do list, and it's got little like columns, and I just add things to like need to do, I'm doing, and then done. And I leave everything on my done one for the whole month, and then at the end I'm like, okay, so I did like 36 things this month. That's really good. So it doesn't matter that I've still got like 5 more that I have to take on to
you
the
can
next
give yourself
one.
a pat on the back.
Yeah, exactly. It's easy to forget about the little wins, and I think it's important to remember them, especially if you go into one file. And I was one of those people that was like, I am going to stay on top of my competencies. Like, I'm not going to fall below the thing. And now I'm like firmly in the red.
That doesn't help. One file doesn't help. It's definitely not your friend on that side.
I think as well, it's important to remember that you wouldn't have got the job if you weren't good enough. And we've had our 6-month probationary period that ended up, and if you've not been pulled aside and like had a meeting, then you're probably doing okay. And you can always ask the people that you're working with and your training officer, as you said, like, am I on track? Am I doing everything that I need to be doing? And they will like help you through anything.
Yeah, and as we're kind of approaching 9-ish, I know we can kind of wrap up. We've got this question here. What would you have done? It's quite interesting. What would you have done if you hadn't gone into the STP? I can answer this one first, maybe. For me, again, this was my second time applying, and my idea was, okay, I'm going to give it another go. And then if not, I didn't get in, maybe I would still work within cardiac and try to find another avenue to continue to progress. Could it have been maybe a part-time master's with working full-time perhaps? So those were kind of the ideas. I definitely still wanted to stay within cardiology, simply because I enjoyed what I did. I had spent a lot of time, invested a lot of time in myself, developing skills, and I didn't want to lose that. So I definitely wanted to stay in the field. I just had to would have had to look for another kind of way to progress, either doing kind of certificates and examinations whilst working full time, or going back into full education. How about you? What would you have done?
So I felt like I'd kind of reached the limit of how long I could just stay in uni for. Pushing on 23, I probably had to leave. But not that you can't be a mature student. I'd just been at uni for like 5 or 6 years by that point. So
because you'd done your master's straight after.
So I'd applied for the health policy fast track scheme, which was it was like a graduate scheme within the Department of Health. And I had found out before I'd interviewed for the STP that I'd gotten a place on that, so I probably would have gone down that route. I knew I was working like I mentioned that I'd done like a full-time job before starting the STP, and that was within the testing department of Health during COVID. And I did love my team, and I really did enjoy the job. I thought it was really interesting, but I knew it was probably not something that I could do for years and years and years, whereas I knew something like clinical would definitely be up my street. I think the politics of working in government obviously would have gotten to me a little bit. So if I hadn't have joined that, I think I would have tried to get like a genetic technologist post and gotten a bit of experience of behind the scenes of a genetics lab, and then tried to go into the STP again.
Okay.
Yeah.
Sounds like you have that's quite a solid plan. Or it would have been a solid plan anyway.
Yeah, well, I don't need to do that anymore.
Yeah. So as we kind of close, we both kind of shared our experiences. Is there anything that, okay, if I paint a picture of somebody that's been listening for the last hour, 20 minutes or so, they've kind of really enjoyed what we've talked about. They're gonna look more into what you've done with your initiative and with mine. They've submitted the application to the STP, and now they're waiting. Then a period where, you know, they just realized that, okay, they may have a bit of anxiety because of the adjustments that have been made with regards to the aptitude test changing and things like that. What would you say to that person that's now kind of doing the waiting game?
It is tricky. I don't think anyone likes waiting that long for anything, and I'm guessing they're probably going to have to extend the deadline just because they're reading everyone's thing now. I think having a backup plan is really beneficial because it helps take the sting out of not getting onto it. I'd applied for my master's the year that I didn't get on, so I knew, like, okay, didn't get on, but I can do this and try again in the future. As advice for between now and then, to be honest with you, I'd just try to find something to take my mind off it.
Yeah, because it is quite a long process.
Yeah.
And that's something that people told me, but still it was difficult to do once you submit the application and you're thinking, you know, how well did I do? Did I pass? Or, you know, some people start receiving emails before you and you're like, oh, what does this mean? Definitely keeping yourself occupied, having another plan in case things don't go your way on this occasion, may be something sensible to do. And one thing that I done, the national school, when they do have updates, the first place that they're going to pull it is the website. So the National School of Healthcare Science website, there's a link in the bio, or if you're watching on YouTube, there'll be a link there. Have a look on their news section. It's going to be up there. Or if it's a tab specifically for students applying to the STP for 2021, there'll be information there on new updates, new changes. So if you're going to go anywhere, then that's the first place that you should go to as well. And yeah, it's just a waiting game that everybody on the STP has been through. So we definitely kind of understand how you may be feeling.
Yeah, definitely. And if you want to be doing something, maybe just start like reading over the curriculum. I don't know, and then you can that's what I do. Read more into my specialism. Find something within genomics that really, really interests you and read more into that, because even if you don't get on this year, if you found something that you're particularly interested, you can do more things throughout that year, like attend seminars, ask lecturers or something at your uni that might specialize in it. You can just really get into that, and then you have more evidence for the next year and you've learned more about the specialism you're wanting to join. So yeah, try to take your mind off it, but if you can't, research a bit more into your specialism.
Yeah, I would 100% agree. So yeah, we can close on that. I hope it's been very helpful to everybody, bringing two people on from two new specialisms to find out more about them. And also, I think I've talked a bit more than I have in the past about cardiac and how that's like as well. So 3 in 1 for today, this evening. So yeah, thank you for joining me. Do you have any last words or comments or anything to say?
I was going to say that I've learnt a lot just from listening to you, so thank you. But yeah, thank you for setting this up. I think it's so useful to have all of these resources out there now. If I was applying this year, I'd be really glad. So yeah, well done for setting it up. You're a lot more professional and poised than I am with my channel. So.
No, thank you. We're trying. And yeah, keep it up with the initiative. and yeah, where we can kind of support each other. And you know, this, I think when I started this, I didn't think at first that this is going to be beneficial for me mainly. I was doing it for prospective students, thinking about how there wasn't a lot of information for me applying when I didn't know a lot of people in the NHS. But actually doing this is good because I'm kind of learning more about different specialisms. So if people do come to me and maybe cardiac isn't their forte, I can now say that, okay, cool. Well, if you don't want to be patient facing, or if you want to work on labs, maybe genomics is something that you can do. So yeah, I think I'm learning a bit as well, and the fact that we can't meet people, I guess this is just an alternative that thankfully I've created, and virtually I can network with people and hopefully meet them in the future.
Yeah. Hopefully if we're both in Manchester at the same time.
Yeah, yeah. Yeah, so yeah, thank you very much. Thank you everybody for still listening. It's been quite a long one, nearly an hour and a half. This will be on YouTube. I will put the links for Meg's initiative on there, and you can follow it. Also, it's on Instagram. I think I've tagged in a couple of other posts as well. This is the fourth one that we've done, the fourth STP Buddies talk. We're looking to do more of these. So far, we've done it once a month. But we're always open to ideas. So if there's something that you want to know about that we haven't touched upon, could it be a specialism? Do you want to find out about not just maybe prospective current students? Do you want to talk I bring on a trainee officer? So you hear about the STP from that side. That can be done. You know, anything is possible. Yeah. So message us, or you can send us an email at stpbuddies@hotmail.com. As well, that you've seen, there's loads of friendly STP students like Alice, like STP Audiology in the comments. These people are just like me, just like Meg. We're here to help and share our experiences. So give them a follow. And yeah, the more you kind of engage and you want to be on the STP, is a way to actually kind of see, wow, this is how it's actually like. This is the reality. This is how a certain specialism looks like. This is what it is. This is what it isn't. So you should be better for it.
Yeah, definitely. One thing I would say is I was always too worried to get in touch with trainees when I was writing my application, because I thought I'd be bothering them. And I don't think anyone feels like that. Even if they can't help you that day, they'll be able to fit it in somewhere.
Yeah. So yeah, thank you very much, guys.
Thank you.
Have a good evening and have a good rest of the week.
You too.
All right, see you guys. Thank you. Bye.
Bye.